Greetings, everyone. Happy holidays and happy New Year. So by now you would have enjoyed your holidays and hoping for a wonderful New Year. Um, so first of all, I would like to thank Professor Dr. Sridhar Seshadri for giving me this opportunity to deliver this keynote talk of for this wonderful web conference organized by SByte Technologies. I'm very grateful for this opportunity, and I'm also thankful to all the other panelists, keynote speakers, and chief guests, and others, as well as the other dignitaries and the presenters for this opportunity to discuss with you. So the topic of the conference is about the role of technologies and innovations related to healthcare in general. And I wanted to talk about a couple of major issues in the healthcare industry, particularly focusing on technology and COVID related issues. Since we're going through the COVID crisis now and we're talking about the second wave and third wave and so on. So I wanted to talk about that. When it comes to the prevention and reduction in propagation of COVID, there is a very clear role for technology. For example, we can keep track of the people who are affected by COVID and the neighborhoods, the regions, the areas where COVID is likely to spread because of such people who have had COVID in the past or have got it recently or have been close to people who have been COVID positive. So this actually opens a whole gamut of data sets. So you need to look at the various types of people entering different locations, moving from one location to another. It's a lot of who are affected, people who are affected, who are likely to be affected because of various reasons. So there is a lot of data that's involved here. And if there is a way to capture all this data, then there are a lot of ways in which we can reduce the propagation of the disease itself. We can, for example, collect all this data, put together using some big data analytics technologies. To begin with, in order to collect them in the beginning, we can use things like Internet of Things connected to the COVID devices, testing devices, or COVID testing centers. If somebody enters there, goes back positive, they will be tracked in the system, and that can be through some kind of Internet of Things combined with the cloud, which then takes all the data points, puts them together in a server where either it can be a cloud server or it's a physical server where these things can be analyzed. There can be some data science algorithms, artificial intelligence algorithms that can be used to understand if a particular person is highly susceptible or not, a particular region is highly susceptible or not to COVID. And accordingly, there can be steps that can be taken. This is one type of technologies, combination of technologies that can be used. I already talked about data science, artificial intelligence, machine learning. You can have Internet of Things, you can have cloud technologies, big data analytics. All of these things put together can help reduce the propagation, track and reduce it. And there is a second approach, which could be community based. So people in different areas, they can enter their data crowdsourced. They can enter the data on if there's anyone in their neighborhood who has COVID, and in that way we can get a lot of information. This is similar to the way when Google Maps were developed first, when Waze as an app was developed. it was a lot of crowdsourced information. So people who are driving in different places, they would provide a lot of data on how the traffic is, how is there a police vehicle coming nearby. All kinds of alerts would come in applications like Waze, and that was also taken later on. That was taken over by Google Map. So all these applications, they worked based on the user provided data, crowdsourced information. So that could be another way. In fact, I'm very happy to be part of a network in the US, which was initiated by Massachusetts Institute of Technology, MIT, Cambridge, and near Boston. The faculty from there initiated it. It's called COVID Safe Paths. That's exactly like what I mentioned in the second idea, where crowdsource all the data from the people at large. So it's an app, people install it and they can enter data. And I think this is also similar to the Arogya Setu app that's already in India. So I'm not aware of the details, but that could be another way. So these are two different ways. First one is more automated. The system itself is self-sustaining and can develop all these insights. Second one is more based on the community contribution. So these are different approaches to reduce propagation of disease, to track it and control it. And I'm not getting into the vaccination. I think some of this can also be used for vaccination tracking. To what extent people have got sufficient levels of vaccination in different parts of the country, world, and what are the gaps on those things. So those things also can be analyzed using the same kind of data sets, the same kind of analysis. The next aspect is curing. Again, there could be a lot of information sharing, information collection on what kind of remedies were included. In India, for example, there have been a lot of Ayush remedies, Ayurveda, Siddha, homeopathy, naturopathy, these kind of remedies, and those could be investigated using real data. So right now we have a lot of data, a lot of studies that have been done using limited data sets, but there is almost a possibility of collecting the entire, if not entire population, but at least major part of the data sets that involve information on remedies used and whether COVID was cured or not, what are the other control variables, and so on. And using that, a lot of analysis could be performed to understand what remedy is efficient and so on. So this could be another kind of technological approach to making sure the remedy works well. So now I addressed 2-3 aspects at propagation, vaccines, remedies. Now let's think about a totally different issue, again emanating from the COVID crisis, but not physical disease, it's mental. So COVID has resulted in a lot of social turmoil, economic turmoil, political turmoil, business turmoil. A lot of different types of crises have happened. Unfortunately, a lot of businesses are picking back up. Society is picking up again. People are realizing ways to live with the virus, and so on. New normal is being established. But at the same time, a lot of people are missing the old normal, and there could be a lot of different types of depressions and distresses. One could be purely economic. People are losing jobs, losing income. They don't have food to eat, to survive their family, and so on. So they are going to be in some kind of depression. The mental health problems that come because of physical scarcity. And there could be another kind of problems, mental health problems, which may involve, you may have all the money, you may have everything, you may be even a celebrity, big business guy or somebody, and everything is going well, but you're not happy with the new lifestyle. So you're very happy going out, mingling with people and so on, and now you're restricted your movements, and that could be like a bad situation. So these two kinds of difficulties that come because of the new normal, that can lead to mental health diseases. And on this, there have been very limited use of new technologies. On this, we have thought about some ideas. We have proposed some of them to some organizations, and that basically, broadly speaking, that involves the use of the kind of the approach I mentioned at the end for COVID, like remedies. What are the different symptoms? What are the different remedies based on the past data? So for a lot of mental health problems, there has been a huge inventory of data sets on what kind of problems, what kind of diseases come up with what kind of symptoms, what kind of remedies have been given even before going to the doctor, some basic remedies for prevention, for initial curing, and then finally, when should they go to the mental health specialist, psychiatrist. So on this, there could be some applications which can collect all this data and update it real time, come up with predictions, and just when if you input, and it could be a mobile app, if you input all your information that this is what I'm feeling, these are the feelings that I have now, this is what I'm going through, then the then the device, it could be a mobile app, but it could also be some kind of an IoT, Internet of Things, which is connected to your body physically. So it can combine your feelings with your pulse and other things that can be tested from your body. So it can actually combine from what your body is going through and what your your verbal explanations of what you think is going through in you. So when these things are combined, there could be some remedies proposed, initial remedies proposed, or initial diagnosis, which can then lead the patient to the psychiatrist later. In this era of this period, hopefully short, hopefully not very long period, when we all hesitate to go to the doctor, hesitate to go out for even for some emergency purposes, this kind of technologies could be really helpful. But it could also become a norm later, because surely because of the convenience. It could be quite convenient. We don't have to travel. We can get a lot of this initial advice through an app. Particularly for a mental health problem which is not life-threatening, at least in the initial stages, this could be a good good kind of proposal. So this is another kind of technologies that we have been working on. People have made some progress. So yeah, these are the technologies or technological ideas, I would say. I did not talk anything about the details of technologies, but I was giving you more like ideas, like architecture level ideas, not even architecture level, but solution level ideas, which can be developed by people based on what is required in all these cases. So that's all I wanted to discuss in this lecture. So I would request all the younger students, researchers, and industry professionals to think along these lines and more beyond these lines, and come up with a lot of innovative technological solutions to solve the crisis. Particularly for the younger researchers and entrepreneurs and so on, this could be a great opportunity for you to come up with something really innovative, and which can actually develop a new kind of technology and approach that can solve this problem the whole humanity is facing, not just India, not just US, not just one or two countries, but the whole humanity is facing. And there is a threat of it coming back again. So thank you very much again. I hope this discussion inspires at least some of you to pursue some research and pursue some effort to tackle COVID and its related problems through technology. Thank you very much.